So contraindications of traction whenever motion is contraindicated. So if you suspect someone of a fracture, you're not going to do traction. Any acute injury, again, just make sure you got to make sure they don't have a suspected fracture or a possibility of a fracture. Any joint that's hypermobile, unstable, and anytime you have peripheralization of symptoms with traction, so you put someone in traction and all of a sudden they're having radiating pain down the back of their leg, that's bad. You need to stop. Precautions with traction: any structural diseases, conditions affecting the spine, tumors, anything with a tumor, infections, rheumatoid arthritis, osteoporosis, or any prolonged systemic steroid use. When the pressure of belts is hazardous, any fractures, medial disc protrusion, severe pain fully relieved by traction, claustrophobia, or people prone or supine, people who have problems being prone or supine, in the prone or supine position for extended times, or any dentures or TMJ when you're doing cervical traction. So how does traction work? Traction is pulled at 50% of the patient's body weight. So someone weighs 100 pounds, you're going to put them on 50 psi. And it's usually on a traction table or an inverse traction table, which is the picture of the lady hanging upside down. You're just using gravity as traction, or a manual, or a water bed, or a manual, which is just holding someone's neck and just pulling it, which we'll go over in lab, or a water bag technique, which is the picture of the man. There's a water bag and you just fill it up to a certain amount of weight depending on their body weight, and they put a sling underneath their neck and it just hooks onto a door and creates traction that way. Static traction is just continuous, meaning it's continually held. It's best for an inflamed area or disc protrusion, and you got to assess the patient periodically while they're on it. The intermittent traction is on and off, and this is good for disc protrusion, joint dysfunction, and again, assess the patient periodically. So the intermittent means that it's pulling traction for a set amount of time, and then it releases, and then it stops pulling traction. Usually with the traction tables, you'll find that there's a setting for that. So how does a mechanical traction table work? Basically, the patient is sat in, as in this picture. As you can see, there's some belts that hold the top of them and the bottom of, like around their hips and around their, underneath their arms. The table itself can be split, so there's a moving part right here. This part stays the same. And what happens is this, you set the traction on this machine and it pulls the bottom of the patient and just pulls the traction. So you got to strap the patient into position and then unlock the table. You want the stool so the hips are at 90 degrees, and then you apply your traction. Again, static traction is completely applied throughout the whole time of treatment, while intermittent, the traction is applied on and off throughout the treatment. Some of the parameters for intermittent, and you're trying to decrease muscle spasms, you want 25% of the body weight, 5 minutes on, 5 seconds on, 5 seconds off for 20 to 30 minutes daily. Joint distraction, 50% of the body weight, 15 seconds on, 15 seconds off, 20 to 30 minutes daily. And then for someone with a protruding disc, you want to stretch the soft tissue, 25% of the body weight, 60 seconds on, 20 seconds off, 20 minutes daily. You want to watch for reflexive muscle guarding. So some people just don't like the feeling of being in a traction table, so you just got to watch, and they'll actually tense up more. So you got to watch for that reflexive muscle guard.